Hi all, welcome to another video wherein I'm going to clear a very important gap of knowledge that students have about ways to come to the UK. So in this video, I will be talking about the two most common routes, the PLAB route and the MRCPCH route. I'll try to make it as simple as I can. For us to work in the UK, we need a GMC registration. GMC stand for General Medical Council. So a General Medical Council will give you license to practice in the UK. So the two main ways of acquiring GMC is the PLAB route and the MRCPCH route. The PLAB route is the basic route that you can give after your MBBS and internship. So PLAB 1 you can give after just MBBS, but for PLAB 2 you need to have 1 year of internship. That's mandatory, and you cannot give PLAB 2 before PLAB 1. So you will give PLAB 1. Internship completed certificate is required to apply for PLAB 2. Then PLAB 1 contains the theory questions, mainly the MCQ, which tests your basic medical knowledge. It's mainly based on the MBBS level of knowledge. And then the PLAB 2 is the clinical exam. PLAB 1, you can have centers all over across India or wherever you are applying for from your home country. But for PLAB 2, the clinical examination, you have to come to the UK. So the centers will be in the UK. So having done that, you get GMC registration and the license to practice in the UK. However, because you have just completed the MBBS and the internship, so obviously it's the basic level of jobs that you get in the UK as there is a FY1 and FY2. So after MBBS, students here go for FY1, which is equivalent to the internship. So if you have completed PLAB from India and you have completed your internship, so FY1 is counted in that. Then you are allowed to apply for the job for the post of FY2. So after FY2, then comes the specialty training. So FY1 and FY2 is not a specialty post, it's a general post. So they are so students are rotated everywhere and they decide in that. Then comes your specialty. So after completing FY2, people opt for specialty. So there are various options that you can opt for, like you can be a GP, a general practitioner, you can be a pediatrician, you can go into surgery, there are endless opportunities. Some people do taster weeks, which is like you are going in a specialty and you are observing a specialty without getting paid. So I can opt for a taster week for 5 days, 6 days, and I can add this in my CV that I have done, because it's valued that you have spent your time in a specialty and you have not been paid for it, and still you were there just to observe the specialty. So it kind of adds a brownie point in your CV that I have done a taster week in pediatrics, or I have done a taster week in radiology, that ways. So you build your CV and then you apply for a specialty. And if you apply, you can go to if you apply for pediatrics, you start with ST1 here. So from ST1 to ST7 is the pediatrics time that you have to invest to become a consultant. So yeah, it's a long journey. Now comes the another option. So MRCPCH involves three parts. So part one is FOP and TAS. The second part is the AKP, and the third part is the clinical examination. For part 1 and part 2 you can give in any order, but after completing part 1 and part 2 only, then you can apply for a clinical examination. So once you enter through MRCPCH, you start with ST1 and then the whole ST1 to ST7. And but however, there's a catch here. So suppose if you have done 3 years of residency in India, 3 years of your pediatrics in India, PG post graduation, so your FY1 will be your internship and your PG first year will be counted as FY2. Your second year in pediatrics will count as ST1, and your third year in pediatrics will be counted as ST2. So afterwards you can join as a ST3, and then from ST3 to ST7 is your another journey to become a consultant in the UK. And you have to be a grid trainee to be a neonatologist in some other video maybe. So that's how you enter the UK. You can enter the UK through PLAB route and MRCPCH route. So now what's the advantage and disadvantage of the two routes? I'll quickly talk about this. So with PLAB, PLAB is comparatively easier compared to MRCPCH. MRCPCH is difficult and it's longer because it's time consuming. There are three steps, and the clinical examination is the most difficult, I would say, because it's very different to what we've been taught in our countries. So the whole idea of preparation for MRCPCH is very different, whereas PLAB is comparatively easier in that sense. So if you are starting fresh, if you are in MBBS, I would say that you go through the PLAB route. But if you have completed your residency already in India, you have completed your post graduation, you are into residency, you are a resident doctor, or you are a postgraduate in pediatrics, and if you want to come to the UK, then MRCPCH is the ideal route for you, because it will going to ask you question related to your own specialty. So it will be comparatively very easy. In fact, when you have given your MD exam, applying for a PLAB test, applying for a MRCPCH would be 10 times more easier than to a person who has given the MD exam 2 years back and is now applying, because it's almost the same set of questions but in different format. For example, they want to know what is there in hemolytic uremic syndrome, the thrombocytopenia, the microcytic anemias. So basically, clinical scenario based on those diagnosis will be asked. So it is quite simpler for a person who has just cleared their MD exams. So yeah, that's it for this video. But there are a lot of things that needs to be covered, which I'll be covering in subsequent videos because it would become very lengthy. So I'm going to cover most of other topics in some other video. Thank you so much for listening.